He's Dean of Faculty of Interdisciplinary Studies and HOD, Head of Department of Biological Sciences and Engineering. Esteemed experts from academia and industry, and my dear participants, I welcome you to this online 6 days ATAL Online Faculty Development Program on Emerging Technologies for Healthcare Applications, sponsored by AICT ATAL Academy. This program has been conceptualized with the objective of sensitizing participants to the rapid technological transformations that are reshaping modern healthcare systems. Through this FDP, we aim to provide participants with exposure to cutting-edge research, practical insights, and translational perspectives from eminent experts. We believe that the knowledge gained during these sessions will help participants integrate contemporary healthcare technologies into their teaching, research, and collaborative activities. So I would like to express my sincere gratitude to AICT ATAL Academy for sponsoring this FTP, and also to our esteemed resource persons who have generously agreed to share their expertise. So now I would like to welcome Professor Ashok Kumar Dubey, who is our Dean of Faculty of Interdisciplinary Sciences and HOD of Department of Biological Sciences and Engineering, to say a few words to introduce our department and motivate us for this FTP.
Everyone, I extend a warm welcome to national and international speakers and all the participants on behalf of the Department of Biological Sciences and Engineering at Netaji Subhas University of Technology in New Delhi. We at the Department of Biotechnology are engaged in research and innovation in the field of healthcare, energy, and environment. We offer academic programs leading to graduate and undergraduate degrees in biotechnology as well as PhD. And as I said, that our main area of focus is healthcare, energy, and environment. And in line with that, the present FDP, which has been funded by All India Institute of Technical Education, AICT, under a special drive to support such programs for the benefit of faculty members across the country. And with our focus, this program has been in the area of emerging healthcare technologies. And as we know that health is a very important aspect along with energy and environment. So this program primarily would focus on the current technologies that have been, or the emerging technologies in the area, for example, wearable health devices, translational nanobioengineering, chip diagnostic system, artificial intelligence in clinical applications, biopharmaceuticals, vaccine platforms, and so on. Over the next 6 days, you are going to have a very engaging session of about 13 exciting lectures. I am very confident that this will be very useful and productive learning experience for all of you, and we are going to have an excellent time getting an update on how things are moving in this area. I wish all the participants the very best and hope that it happens to be a wonderful learning experience for all of you. And I thank you and wish you the very best for that.
Thank you so much, sir, for encouraging us. Now I welcome our chief patron, Professor Anand Srivastava, who's our Honorable Vice Chancellor of Netaji Subhash University of Technology. So he has been the guiding force behind this FDP. Sir, we would like to hear from you as well. Thank you.
So good evening, good evening, morning. I think you have international speakers as well. So faculty members, Professor Dubey, Dr. Shilpa, researchers and participants. So let me welcome to this FDP, which is AICT Training and Learning Academy sponsored FDP on emerging technologies for healthcare applications. I think things are changing. We are redefining the way we, prevent, diagnose, or treat or manage diseases, right? So technology is playing a very, very important role. We need to shift from reactive to predictive care, from move towards personalized healthcare. So this transformation is driven by multiple, technologies. Few of them are, for example, artificial intelligence and machine learning. You can do some medical imaging, predictive analytics with a lot of accuracy and faster. Internet of Medical Things, IOMT. We have heard of Internet of Things in electronics and in computer science. Similarly, you have Internet of Medical Things, where all those variables, they are the devices. You get data from them, from those devices, smart sensors, monitoring devices, and connected health platforms for empowering patients, improving disease management, and reducing the burden on healthcare infrastructure. Another area is big data analytics and cloud computing. So whatever information you get, you have to extract some useful information from there, from that data. So that data has to be cleaned, curated, and then we use that data and do some edge computing or cloud computing. So this is definitely going to improve, and it is going to be faster, and it is going to result in large scale health benefits. In order to ensure security of the data, again, technology like blockchain, that is important. Things like robotics, 3D printing of organs, AR, VR, these are some of the technical areas which actually support your health. So while technology is playing an important role, we also need to respect the data of the patient. So we should, issues of data privacy, ethics, bias, then regulatory compliance. These are also important. So we should not, lose sight of these things. And as NSUT being academic institution, we should design our courses which actually are interdisciplinary in nature. And you have inputs from technology people, you have inputs from biological people, electronics people, and also we should focus on translational research. Publishing paper is also fine, but then whatever you do should be converted into some sort of product or process which is useful to the mankind. And also we should encourage collaboration between engineers, scientists, and policymakers, and prepare students to innovate responsible so that there is a societal impact. We are also starting a course on AI in healthcare along with Gangaram Hospital. So we had discussion last week on this. Team from Gangaram had come, where we have designed the 2-year course on AI in healthcare. The healthcare part will be taken by the Gangaram Hospital, and the technology part, we will be focusing on the technology part, and we will get real-time access to the data from there, and then we'll be able to solve few of the real-world problems under that particular MTech program. So it is an excellent initiative taken by the department. I congratulate the organizers for initiating this important discussion and wish all participants a highly engaging and impactful program. And thank you, and I wish you all a successful and enriching experience during the FDP. Thank you very much. Thanks.
Thank you so much, sir, for such a motivating words for the department and for this FDP. Thank you so much for your guidance. So now it is 6:20, so we have first session at 6:30. So I request all the participants to be active and interact with the speakers and make most of this learning opportunity. We will also be floating attendance links, attendance will be recorded for every session. And on the last day, that is 10th January, there will be an online test which all participants have to participate. And based on their performance, certificates will be issued on the ATAL portal itself. So I request all the participants to sincerely attend this program and make most of this opportunity. We have industry experts, we have academicians in diverse areas of healthcare. So it is a good platform to enhance your knowledge in this area, which you can productively use for your research and teaching as well as mentoring your students. Thank you so much, sir. Thank you, Professor Anand Srivastav and Professor A.K. Dubey for joining this inaugural session. We look forward to the talks, which we will start at 6:30. So I request all the participants, we'll have a short break and request all participants to join at 6:30 for the first talk, which is by Professor Arnab Chanda from IIT Delhi. He'll be talking on healthcare product development and entrepreneurship, which is a very good topic for youngsters, especially in this area where Make in India is being promoted by the government very extensively. So thank you so much, sir. We'll join at 6:30. The meeting is on, and we'll be back at 6:30 for the next talk, the session 1. Thank you, everyone. Good evening, sir. Professor Arnab is here online. Dharmesh, kindly make him co-host.
Yeah, thank you, Dr. Shilpa. And
Yes, sir.
good evening, everybody.
We welcome you, sir, and thank you for accepting our invite. Yeah, now I request Twinkle to kindly introduce our eminent speaker. Over to you, Twinkle.
Thank you, ma'am. I take great pleasure in introducing our first speaker and sharing a brief overview of their biography. Professor Arnab Chanda is an associate professor in the Center of Biomedical Engineering, IIT Delhi, and a joint faculty at the Department of Biomedical Engineering, AIIMS Delhi. He is also a founder of startup company BioFit Technologies, USA. He earned his PhD from the University of Alabama, USA, and also has been a postdoctoral researcher at the University of Pittsburgh, USA. Dr. Chanda is an expert in the area of biomechanics, especially in a tissue mimicking and characterization, finite element modeling, robotics, and wearable device development, and entrepreneurship. To date, he has received Young Research Award and Early Career Award from ASME, MHRD, and AO Spine International Singapore. Book Author Award from Springer and Top Cited Paper Award from IOP Publishing and Wiley. He holds and has filed 10 plus US and Indian patents, authored 8 books and 100 plus articles in reputed international journals. Dr. Chanda is in the list of top 2% scientists worldwide as per Scopus, Elsevier, and Stanford University database in both years 2023 and 2024. He also teaches 3 successful executive programs Executive Program in Healthcare Entrepreneurship and Management, PG Diploma in Healthcare Product Development and Management, and Executive Program in Robotics, and multiple SWAYAM and NPTEL course to engineer, doctor, and management professionals. Dr. Chanda is serving as Associate Editor, Journal of Applied Biomaterials and Functional Materials, Associate Editor, Frontiers in Medical Engineering, Editor for Biomedical Materials for Multifunctional Application, a book series published by Springer Nature, editorial board member for Nature Scientific Report, and a guest editor for several journals such as Engineering Research Express, IUP Publishing. Now I request Sir to take over this session and enlighten us with his expertise.
So
Over to
thank
you,
you.
sir.
Thank you very much, Twinkle and Dr. Shilpa and the team for having me today. And thank you very much for the kind introduction. So I'll just share my slides. Hopefully I'm sharing rights. Let me just pull up the slides. Okay. I hope my slides are visible and you can hear me fine.
Yes, sir, now it's visible.
Okay, thank you. So I was asked to speak about healthcare product development and entrepreneurship today. So thank you for the introduction again. So just as a quick note, I'm an associate professor with the Center for Biomedical Engineering, which is one of the oldest center which works on biomedical innovation and technologies in India. It's a joint center between IIT Delhi and AIIMS, which was built with the purpose of bringing healthcare products into the market. And previously, I've also founded a company and been extremely engaged in healthcare product development side and entrepreneurial ventures. So this gives me immense pleasure to speak on this topic, which is so close to my heart. And I'm hoping the audience will get something out of it and will have something to take forward in the domain of healthcare product development. So with that, let me get started. Okay, so as this is an institutional work like which we usually do, we are associated with institutes. So what we are all primarily associated is with healthcare research, from which the products and the entrepreneurial ventures eventually emerge, right? So the aim of healthcare research, if we see as a whole, it's become extremely interdisciplinary. Over the time, it has changed a lot. It is to develop products and solutions which can help in diagnosis, prevention, treatment of injuries and diseases. At the end of the day, it should be for the better well-being of the society, right? So in order to achieve that objective, there are multidisciplinary topics in this area. So healthcare is quite broad. When we say healthcare products or healthcare services, it encompasses a lot of sub-disciplines. And some of those important sub-disciplines include, yeah, sure. So we can take the questions in the end. Thank you. Yeah. Some of the sub-disciplines include biomechanics, which is understanding the mechanisms of the human movement. Biomaterials, those are everything to do with biological materials, which can be used in implants and medical devices. The entire medtech industry stands on the pillars of biomaterials. We have bioelectronics, which is one of the oldest branch encompassing biomedical engineering, where we try to understand through electrical signals what all could be wrong inside the human body and what all can we possibly prevent or improvise, right? So bioelectronics is again a subfield. Then we have bioimaging, and this is one of the most common thing which is available to everybody, where we get an X-ray done, we get an MRI done. These are all bioimaging techniques to figure out whether you have a disease or there is a concern to report, right? And then you have bioimplants, which is kind of an adaptation of biomaterials and the medtech industry as a whole. So skilling in this area will help identify current healthcare challenges in India. So it is very important when we conduct healthcare research to really understand what these areas are broadly. That is step number one. And second is understanding the challenges. What are the current healthcare challenges in India? unless we take a deep dive into those challenges, it will be very difficult to build products which could be useful for the nation. Because whenever you're going for a product development, that's one part, and whenever you're looking for entrepreneurial ventures, there needs to be a product market fit. So the product has to be as per the market demands or need, right? So if we are able to identify the right challenges and work with them, we should be able to design and develop biomedical products. Of course, it requires certain levels of expertise into designing and prototyping, but those things can come. Right. And finally, once we do that, this is either for clinical needs or personalized needs, or, these are broadly the two categories. And finally, if you're able to develop that product, you try your level best to take it out in the market. So the government of India is very much focused on translational products, typically in the healthcare domain right now, if we are talking about 2025, 2026. Right. So these pictures give you a snapshot of some of these key sub areas, including the first picture showing biomechanics. Then you have 3D bioprinting, which is one of the latest areas. Then you have some bioelectronics based assessment and whatnot. So all these sub-disciplines, the goal of learning about all of these sub-disciplines and how they work, what are the studies, what are the hands-on, is to finally help us build healthcare products. So that is the overall goal, right? And that goal over the years were not that popular because the mandate was more into the research component, but right now it is at the fair front where everybody is talking about translation, right? So this puts us in a very nice time to talk about healthcare product development and entrepreneurship. Okay. So healthcare product development is the step one, where we understand about all the sub-disciplines and the challenges and try to design and develop a product about it. But there is more to it if we want to push it to commercialization. So this is the second big push by the government right now, is you don't only develop product, you try to translate it, and it is even better if you're able to commercialize it through startups or through technology transfer, something or the other, right? So that's the next push, so that it actually reaches out to the masses and the products are not lying in the labs, right? So if we look at the summary of the situation, right, you're looking at healthcare problems where everything starts, and that's the golden start of everything. So this basically is built around markets and customers. So I'm going to bring in a little bit of entrepreneurial flavor here. So you have a healthcare problem, that is great. Many of us are, interacting with doctors. Many of the doctors attend our sessions, they are all coming with some clinical or healthcare problems. But at the end of the day, it is all about the markets and the customers. It's not about these specific problems. There are thousands and lakhs of problems. So what problem to really work on is clearly dependent on the market and whether there are customers, right? And that helps you refine and get into a nice idea, which you can potentially pursue for development of the product and commercialization, right? So whenever you're looking for the term commercialization, it is not only a product development. You will have to think in parallel about the market and the customer. Then comes, once you're able to basically pinpoint on what ideas you want to work on, you start developing a product. So while you start developing a product, there are different steps of the product development cycle, which leads from design to prototyping, right, to actually building a product, and finally testing it and comparing it against standards. So whenever we are talking about products in the healthcare domain, there are lots of regulatory bodies or regulatory standards which comes into the picture. So I just cannot build a product tomorrow and say I want to test it or put it in a human body, right? There are lots of regulatory considerations which comes handy. So there is a regulatory body known as CDSCO in India, which basically regulates majority of the medical devices, whether you're looking at some peripheral devices. So all those standards come into picture. You have to comply with them some way or the other, or you have to play around it, to make sure that you build a product which doesn't require a lot of compliance. That is one part. The other part of the product development journey is you have now developed some product, but does the customer actually need it? Have you developed something which is really useful for the customer? So this is a very important question in the area of entrepreneurship, because we end up developing a lot of products, be it in the healthcare segment, biomedical engineering broadly, but majority of those products are still in the labs, and the reason they are not out is because there are no customer basis for it. Nobody wants them. The customers probably needed something else and we built something else. It is useful, but it is not super useful to the customers, right? So that is where during the product development cycle, we should not be only mindful of the design to development and testing standards, but also looking at customer acceptance. Now, how do we do that? That's through a thorough process, which is known as customer discovery. I'll take you through a glimpse of that, like during sharing of one of my entrepreneurial journeys, right? Then finally, if you are able to develop the product which is appraised by the customers, that this is you have taken our feedbacks, this is exactly what we need. Your customers could be clinicians, your customers could be the common man, your customers could be hospitals, right? So if they are able to approve your initial design ideas and product ideas, like, then you have developed a product which is of use. Then finally comes, now I have got a product which is of use, but how do I actually sell it into the broader market? So that is where the commercialization steps come into the picture, which includes lots of interesting steps, which many of us, like if you're coming from engineering background, we may have never heard, which is branding, marketing, sales, looking into IP rights, right? Like, because whenever we are building products, we need to be worried about the intellectual property. Otherwise, somebody can just maybe steal our products or copy our products, right? And building a company. So there needs to be a lot of brand building exercise. There needs to be a lot of marketing efforts, sales highlights, sales projections. All these things come into the picture. So if any of you have watched Shark Tank, you would know a little bit of what I'm talking about, right? So just getting the product there is not good enough. You will have to commercialize through all this with a clear goal of one single thing: you need to make profit. So whatever nicest product which you build for the market does not matter. This is a lesson which most of the entrepreneurs learn in a very hard manner. I have learned it myself in a very hard manner. So I'll showcase one journey of myself where we had developed a beautiful product. We were extremely overjoyed about it, that this is going to really take over the market, and nothing of that sort happened, right? Actually, we had to pivot and change the product completely because we were getting zero profits. Right? Because when you are out in the market, people talk in terms of profits. What's your top line? What's your bottom line? So the entire conversation changes, the entire language changes. So that is the flavor of the healthcare entrepreneurship or the healthcare product development market. That one part is developing the product, and second is being mindful of what is the latest going on in the market, who all are your competitors, how to take it out there in the market and look so unique so that customers will take your product. So hopefully this summary statement is quite clear to everybody, like that how a healthcare product moves from the idea stage all the way down to the commercialization stage, which is going into the market, right? And some of the pictures on the left side just kind of breaks down these steps where you basically do a bunch of exercise to get to the market commercialization, right? So I'll just skip that. Okay, so whenever we are talking about healthcare products or why we should develop healthcare products, I always like talking about the broader market, because these are all driven by the markets. Building the technology is something which we always do. That is what our expertise as engineers are. But market digging is something which we do not do. And it is important to know what is the market, what are my job opportunities, what are the trends in the market, where if I build a product or if I tend to work towards a company where I'm trying to learn something, it's going to lead to, right? So we broadly looked into the biomedical engineering market, which is the healthcare engineering market, building products. So we saw that the industry is growing at a very high rate, right? So 15.12% industry growth is a very high number. Usual industry growths are like around 4 or 5%. Those are considered to be okay. So 15.12% means it's growing at a very high stage. So there are lots of companies which have taken their place into the database, which is nice. There are a lot of employee growths, which clearly states that more and more healthcare engineering companies are coming into the picture and doing hiring. There are lots of patents getting filed, and India is almost getting into the fair front. Gone are those days when India was not leading the healthcare market, but right now we are big in medtech. Whether you talk about AI in healthcare, medtech, wearable device development, we are all over the place. Also, if you look at the engineering market as a whole, the engineering market has grown overall by 9%, of course, with lots of interest into AI, machine learning, and all the drivers into robotics and whatnot. But the biomedical engineering market, in comparison, has grown around 7%, which is a good trend, right? The total of all other occupations, if you take out engineering and specifically biomedical engineering, is just grown 4%. That means this is the right time to venture in this area. So this will hopefully give you enough motivation to dive into this area and look at product development. This is as per the US Bureau of Labor Statistics. So, okay. So in order to understand the market fit even better, what we did was we did a further market survey to really understand that what is that which the aspirants are looking for, what is that what the industries are looking for. We should know that, because if we are trying to develop some new programs for skilling, or we are trying to develop some new products, which domains would they fall in, right? So we surveyed around 1,300 aspirants who are all seeking engineering positions or are going to get into the engineering colleges all around the country. So we saw these are some of the top areas, and this gave us some market highlights, right? If you look at the top expectations from them, we found that be ready to build future healthcare technologies was one of the topmost, which is exactly what our hypothesis was. So we were quite enthusiastic about looking at that. And of course, AI, ML in healthcare, which is one of the buzz things, is topping the list, followed by medical robotics, biomechanics, and many other areas like medical devices, biosensors, and so forth, which are taking an account. Healthcare entrepreneurship and management is also quite popular, right? We also surveyed around 120 plus industries and asked them that, what are you looking for? There are a ton load of people who are ready to, take up degrees or take up or build products. What are you guys looking for? What are you guys looking for? What kind of products do you want to build? So 120 plus industries were surveyed. We went into a medical fair, which was in Pragati Maidan, and we went for many other surveys, which had a showcasing of some of the top healthcare products in the Indian, setup. There were a lot of imported products as well, but we did get to see a lot of Indian products which are completely indigenous. So what we saw was the industries had a very similar setup. They were actually looking for biomedical engineering graduates or people with a healthcare products experience. So also some additional experience from clinical experience with AIMS or some similar hospitals was highly desirable. So we saw a huge match between what we are trying to skill the world towards and or the country towards and what they were looking for. So it seemed like there is a huge market for healthcare product development. So that gave us an idea that healthcare careers are at rise, and people should focus on healthcare product development. This is one of my articles, in 2025, which is developing healthcare products in India, the market dynamics, the emerging trends, and the career pathways. Everybody's welcome to read this. But these are some quick highlights from this. Engineers, biomedical scientists, product designers, and regulatory experts and manufacturing specialists are finding rewarding pathways in healthcare product development. So if you are trying to train yourself in any of these areas, this is of huge importance. There is an increasing demand for professionals who can not only design functional prototypes, but also navigate clinical trials, regulatory frameworks, and market access strategies. So you do not have to only be somebody who can build a product, but you have to also learn regulatory frameworks, the market access strategies. The global medical technology firms and domestic health tech startups alike seek talent with interdisciplinary expertise. So gone are those days when we were only from a particular department and with a particular type of expertise and career scope. So I am broadly a mechanical engineer. I started off as a mechanical engineer. I moved into like biomechanics very early in my days during while I was in the US, moved into a bunch of departments and became extremely interdisciplinary, and finally joined the Department of Biomedical Engineering in IT Delhi. So that's the kind of expertise, and the kind of students whom we train are also very similar. We are seeing an extremely interdisciplinary approach where somebody needs to understand mechanical engineering, somebody needs to understand electrical engineering, core biology, and clinical science, right? All these together, and to some extent management if you want to really be entrepreneurial, right? So those who are capable of blending technical acumen with human-centric design and a firm grasp of health economics are the ones who are going to be extremely successful. So this is what we found from landscaping the Indian scenario into the healthcare products, right? So you're welcome to read more into this article, but this is just to set the stage, like where healthcare products market is in India currently. Okay, now comes to the step one of understanding why or what healthcare products to be built. Because okay, so we all want to build healthcare products, but what products and what is going to drive that, right? So it is good to look at some of the common challenges and healthcare problems in India. I have a bunch of slides which I had, like, but I tried to filter out a few just to capture some of the highlights. So India, if we all recognize, is the second most populous country in the world. I would like to say it's the first most populous because we don't come very well, like in the census, right? The death rate has declined, right, over time, but birth rates are still continuing to rise in most of the states, right? Why has death rate declined? Because of the advances in the medical science, right? We have advanced techniques for treating people, whether you are having like very problematic diseases like cardiovascular issues or diabetes or cancers. You can still live okay for a few years, like at least the lifespan has increased as much as possible, like in the market. So that has overall brought the death rate down. Healthcare structure in the country currently is overburdened by increasing population, right? This we all know. You step into a hospital and it is just full of people just waiting to be seen by the doctor, right? Even if you go to top private medical facilities, I'm sure all of you are from Delhi, so if you have ever stepped into the Max Healthcare in Saket, sometimes the OPDs would shut down after 12:30, 1 o'clock, because it's just huge footfall. The doctors do not have time to see, like it's just a lot of people with lots of diseases. So the healthcare structure in the country, think about this in non-private hospitals. It is just overburdened with an increasing population, right? So India faces the twin epidemic of continuing, just 1 second. I'm in a presentation, bye. Yeah. India faces the twin epidemic of continuing and emerging infectious diseases as well as chronic degenerative diseases. So we are seeing a very new surge of diseases. If all of you recognize, 10 or 15 years back, remotely somebody in your family may talk about some cancer symptoms or somebody having cancer, But recently things have changed quite a bit. Recently, if you're seeing, every other family has somebody, like, in the relatives, like, who has been diagnosed with cancer, with some sort of cardiovascular issues, some sort of diabetic issues. So all these chronic diseases, which are considered to be kind of lifestyle diseases, are becoming more and more infamously popular, right? That states that you need to build products or technologies which are particularly in these areas, right? About 21% of the elderly in India reportedly have at least one chronic disease. Okay. So this is a big problem, right? Elderly, if you pick out anybody, like, they're having at least one chronic disease. Think about somebody with comorbidities, multitude of diseases. So this is becoming even more and more challenging. And hypertension and diabetes, if you look at it, like, they account for 68% of all the chronic diseases. So this figure on the right side kind of takes you through the journey of what are the top diseases to focus on. So if you look at it, actually, cancer is at the bottom. Cancer is just about to start. Like, this entire industry, many of us may think that cancer is at its rise. It is at its rise, but It's not there yet, like in the top list of things. Diabetes is already there. India is already the diabetes capital of the world. We are looking at hypertension. We are looking at heart diseases as a whole, asthma, thanks to the air quality and everything in the different states, right? Including Delhi. But if you look at air qualities in other states, they are equally bad, and all these diseases are taking the top notch, places. So these are the healthcare problems and challenges, like in India broadly, which tells you that these are the top places or areas to focus on, right? So what are the categories of healthcare products? Next, let us take a look. Now that we know what are the top challenges, let's look at what are the broad categories of healthcare products before we try to recognize that what can we build for the future. So let's take a look. So healthcare products are broadly divided into some specific categories. The first category is known as diagnostics. So if you look at the current country's push, like we are pushing a lot towards building more and more diagnostic facilities, diagnostic AI-based systems, diagnostic wearables. Like this is the primary push by the government of India, and there is a lot of funding which is flowing into this areas, particularly by ICMR and the top funding bodies. So if you look at diagnostics, it is everything to do with all the instrumentations and methods which helps you diagnose a disease, like from very specific stethoscopes to sphygmomanometers, diagnostic sets, otoscopes, ophthalmoscopes, pulse oximeters, fetal Dopplers, and ECG machine. These are some very common diagnostic devices to recognize. That's why I just decided to place them. There are more larger and smaller diagnostic devices like the MRI machines. Many of you may have heard, if you follow the news, that recently somebody has created the very low-cost MRI machine in India, which is going to get sold like completely made in India, which is going to reduce the price of these devices by manyfold, right? Then you have spirometers, you have X-ray machines. All these machines, if you majorly look at it, they're all imported right now in India. Majority of this device. So even if you start picking up one of these devices, which are commonly used for diagnostics, and start building an indigenous version of it, you can be making a lot of money as an entrepreneur, right? Next category of healthcare products are implants. So this is the entire medtech industry, which is given also known as medical devices or implants. Biomaterials are a subset of implants, basically. So implants go all the way through your body. Gone are those days when you have just 7 or 8 typical implants like the hip implant or the knee implant. You would have implants which are as small as like a aneurysm clip, which goes inside the brain arteries, very thin brain arteries, to all the way down to the foot, where like you have all kinds of orthopedic implants, plates, screws, fixation setups and whatnot. So this is an example of a knee implant. Then this is the classic hip implant. These are all parts of medical devices where there needs to be a surgery. There is a lot of regulatory compliance which needs to be followed. So if you look at the medical device policy in 2018, there was a clear mandate after that all the medical devices, whatever goes inside the body, needs to go through thorough regulations of a evolving policy, which is a medical device policy made in 2017, which got implemented in 2018. So before that, there are a lot of startups which could make whatever they like and basically circumvent the medical device policies very easily and quickly go to market. But after 2018, due to a lot of mishaps, many of those companies, had to be regulated. So now the overall regulation cost goes up because you need to run through a lot of tests, the tests of biocompatibility, which is to make sure that a device can go inside the body and not create any adverse reaction, test of mechanical testing, and there are so many other tests which you need to conduct with third-party lab, get things certified. So if you are trying to work on implants and medtech industry, it is good to work with an existing company rather than starting a entrepreneurial venture with implants. That is one of my recommendation, because this is a little bit asset heavy. you are looking at very high initial investments. If you do have that investment, go for implants, because this has good barrier to entry. So barrier to entry is a term in entrepreneurship which tells you that others will not be able to build or replicate your products very easily, because you have spent so much of time and energy in building this. Nobody will be able to cut short those processes and go through regulatory processes. So if you're in this market, you can be making a lot of money, but you have to be patient and spend the first 2 years just investing and getting your regulatory compliance done. And then you are into the market. It's not a very quick go to market. So there are lots of implants, whether you are coming from a dental area, there are lots of dental implants which are coming into the market as we speak. More and more are getting developed. There are spinal implants which are threaded in different zones, elbow implants, you name it, and there is an implant in those areas, right? So this is a market worthwhile, exploring. But the recommendation is, if you're trying to do an entrepreneurial venture, be a little careful, because it may be investment heavy, right? Next is assistive devices and orthosis. So if any of you are back from the 80s or the 90s, you would have seen a wheelchair back in those days. And if you look at wheelchairs right now, they're quite different. The reason being that there has been a lot of innovation into the wheelchair space itself. There have been so much work into the wheelchair to make sure that there could be something automatic. It could climb the stairs or be up the ramp. There are certain things which the patient can do by themselves rather for somebody to come and help. Of course, there are different variants of it, but there has been a lot of innovation within the wheelchair itself. There has been a lot of innovation into walkers. If you fracture your leg, there are lots of innovative walkers. So assistive devices and orthosis is after something happens, and those are the medical products which are there into the market, right? Then there are assistive attachments like prosthesis and orthosis. Prosthesis is something which replaces an existing body part, right? To have you rehabilitate to normal. And orthosis is something where it doesn't replace a body part, but it aids in improvement, like, or better gait or better walking, like, right? Like, so insole is an orthotic device. So if you have an insole in your shoe, that means you would have had some pain from your, walking daily or some kind of exercise, or if you're wearing high heels, and an insole is helping you alleviate that pain, right? Adapting writing attachment is a very interesting kind of tool. If you look at the kids these days, the disease which is at huge rise is attention deficit syndrome. ADHD and these kind of syndromes are at quick rise. Like, we would never hear about these kind of issues like 10-15 years back. But if you right now look at 1 out of 5 or 10 kids, they would have some attention deficit syndrome or something or the other, because of the change of course, the nuclear families and whatnot. So this is a very interesting product. You can just quickly 3D print it and start selling it. So what this does is it allows you to hold the pencil or pen in the right way and teaches you how to write normally. So this is again one piece of the healthcare product which is very simple to build and can have a huge impact. So this basically highlights that healthcare products, when you're trying to build or be entrepreneurial, doesn't always have to be very, very complex. So whatever comes to our mind initially, being an engineer, is I want to build a robot which is like 100 or 200 parts, which does this and this, probably uses an AI and machine learning module to conduct this and that. But just wait a second, right? Just take a step back and think, will you be able to replicate and make 10 or 20 models out of it? Will you be able to be entrepreneurial with that? So I'm not saying go for a product which is extremely low cost. Go for a product which is moderately cost, but you can find entrepreneurial opportunities even in very simple products. So they do not have to be always a very complex product like a prosthesis or some robotics, right? So this is just to give you an examples of assistive devices. There are n number of other assistive devices, and there is a lot of opportunity, like for you to 3D design and 3D print them and make them personalized and custom. Right? If you look at any braces, splints, they are currently all coming out of off-the-shelf solutions. And if you actually look at, majority of the solutions right now, everybody has a different hand size, body structure. Can the off-the-shelf solutions like work for everybody? So that is where you need personalized solution. I work very closely with the Indian Spinal Injury Center, where we visited, and they were like, if you can just 3D print, we'll sell it for you. So I saw a market there. All I have to do there is basically go there, pick up any of their splints and braces, 3D print it as per the sizes of whenever a patient walks in. And if I can make the cost and calculations right, I should be able to be like entrepreneurial in no time. These are all based out of Delhi. I'm giving you some opportunities which are in Delhi itself, right? So these are the healthcare products where hips and thigh splints, like pediatric orthotics, like, right now there is a huge surge of, localized product which are focused on the pediatric population, which is for kids, because that is a segment where parents are ready to pay anything. Even if you charge like 50,000 for that, if somebody has an concern with walking, they are ready to pay 50,000. If you make the same product for an adult, they will question even why this is like 999, why not 300 rupee discount, why not this and that. But if you look at pediatric product, that is a market very easy to venture into. So hopefully some of these discussions, of course, this is a very short amount of time, will open up your eyes into how to be entrepreneurial very, very quickly. And that is the goal which I'm trying to set while I discuss some of these products, that there are so many opportunities right there, right in front of your eye. We may not be recognizing that. So whenever you start thinking as an entrepreneur, you'll start seeing most of the things ahead of you as opportunities. And pediatric orthosis, like, which is lots of, kids, toddlers specifically have issues walking. They have like club foot, or they have certain curve gait, like due to which they are not able to walk properly. All you need to do is like 3D print and create some orthosis for them, and it should be a very popular solution. If you're able to customize, you can charge anything for it, right? Next is, if you're looking at diabetic insoles, India is a country which is currently known as the diabetic capital of the world, and which is not a good title to have. And diabetic capital means like whosoever has diabetes has a very high chance of developing something which is known as a foot ulcer, diabetic foot ulcer. Some of you may have remotely heard that somebody got their foot amputated because diabetic foot ulcer went too far and led to a gangrene, and they had to cut out a finger or something. So this is what diabetes does to you, right? So you need diabetic insoles to prevent an ulcer from actually forming. And then you need some further products to prevent the ulcer from spreading. So there is so much of innovation which you can do, right? So diabetic walker boots, which is for offloading pressure, because these are all triggered by pressure. Whenever you have a high pressure on certain points, that is where the ulcer develops. So if you're able to offload or take off the pressure from the majority of the foot, like typically the heel regions and places like that, you should be able to develop a new product. All these products are missing in the Indian market. People are talking about it, people are happily importing it, but we are not building it. So that is the time which needs to change. We need to be less scared. We need to thoroughly understand the market and jump into it. Next part is wearables. And this is again a newer market which is getting super popular. As we speak, these technologies are just flooding the market. So if you follow LinkedIn, or, you look at Facebook, or you're watching Reels, whatever you're doing, this is the generation. So you would have seen, Dipinder Goyal from Zomato, he's wearing that temple wearable, right? Like very recently it has gone viral. So this is one of the wearable technologies. It's reading his blood signals or whatever is the flow rates and other things in his brain, right? So very similar to that, you have smart glasses, which are for improving ADHD patients. There are lots of other specific areas in which smart glasses are used for attention span improvement, and also for improving mental health. And smartwatches, of course, they're all around the place. All of us are wearing, knowingly or unknowingly, a smartwatch, and there are so many options and medical wearable features which can be integrated. So if you look at an expensive Apple Watch also, the maximum which you get is a heart rate, which doesn't tell you too much, and some SOS alarms. But there is so much opportunity to read skin conductance, give you details of your glucose levels, give you details of so much more if you can work with algorithms and simple steps to integrate with a smartwatch. Then another thing is a glucometer. if you have seen glucose monitoring for diabetic patients, usually you have that glucometer which pricks, right? Which is a needle which pricks, takes out a blood sample, and then you have strips. So usually you buy a glucometer for 2,000-3,000 rupees, and then you keep on buying those strips for 1,000 rupees, at the strip case or whatnot, and it's a consumable. So non-invasive glucometer is the new thing where you do not need to prick. So this is a device you just place. It has some connection with the, some little penetration with the skin, like not invasive, and it continuously monitors the glucose, right? So these are very important. Activity trackers, hydration monitors, posture correction devices, because look at somebody who's working on their laptop, that is all of us. I spend at least 8 to 9 hours in front of a laptop, and it is very common that I'm looking at the laptop like this and I would develop a neck pain. So there is a posture correcting device. Just look it up, upright, right? So it gives you an alert after every 10 minutes, just please correct your posture. That itself is so useful. So you have wearable technologies which are going to improvise your life from a personalized standpoint, as well as in a long-term standpoint. Because at the end of the day, if you are just living a very sedentary life where nothing much is going on and you are just very, very lazy, then all the diseases will start coming. So that's where wearable technologies are making a huge mark in the market. The next area of healthcare products are the robotics market. So currently, if you look at the world, the entire world is talking about humanoids, robots. Robotics is something which has found a new interest again. And as we speak, China and some of the other countries have warehouses full of robots which are already building something known as ghost factories. India is not able to reach to that level of manufacturing because we are not deploying robots like we should, right? So if you look at surgical robots, if you go for a surgery, you would typically have a option these days, which was not there 10 to 15 years back, of a normal surgery, traditional surgery, or a robotic surgery, which would cost you 1.5 to 2 times more, right? So these surgical robots, which are typically known as Da Vinci type of robots, these are not very commonly available. These are extremely expensive. You're looking at a 5 CR plus for a, Da Vinci robot if you want to import it to the country. I think All India Institute of Medical Sciences, AIIMS Delhi, recently got one after several years of tendering and whatnot, and it got one of these robots. But there is another company in India, I forgot the name of the company, it started building indigenous versions of these robots for 1/5 of the price. So this is what we need to start building. We need to be building such surgical robots. Look at the market. You're sitting on $1 billion market. So that company who has started building these Da Vinci robots, if they are able to validate or get to that level, tomorrow they are going to completely replace the Da Vinci robot because of the price point. In India, everything works in price along with the quality. It has to be maintained when you're in healthcare. So they are sitting on $1 billion market, just trying to create a monopoly in the market in no time. Before you would know, they may be a monopoly. So these are the markets to be looked upon. Neurosurgical robots. This is an area we have very few neurosurgeons around the country. So can we build such niche robots which are neurosurgical, which can create neurosurgeries? Robotic arms for rehabilitation. Lots of people with spinal cord injuries which have rehabilitation issues, partial paralysis of the upper limb, lower limb. Can we use robotic arms? Can we build custom robotic arms? The last one is interesting. It looks funny, but it's known as a behavioral therapy robots. These are getting very popular in the market because of all the mental health issues which are coming. So before the pandemic, nobody used to talk about mental health. After the COVID, everybody talks about mental health. The government also talks about mental health, right? So while I was in US, what I've seen is typically whatever issues or breakthroughs or something happens in the US typically happens in India after 10 years. That was the time frame. So mental health is very well understood, very well recognized. There are proper procedures, proper medicines. So nobody says that you're mad that if you have mental health issues, right? So that is never the case. But in India, it took a while to catch up and the COVID kind of triggered it. But now the divide has decreased, with the world coming together, and India is in a few, it's growing just exponentially into the healthcare segment, where we are going to take over US and all the countries in no time, the rate at which we are going. But this is an area, just think about a behavioral therapy robot, somebody who is alone, think about an elderly person who may not have their children around, like nobody to look after. You have a behavioral therapy robot which just asks you, how is your day? How are you doing? Reminds you of the medicines, probably gives you some motivational lectures. This would be so much helpful. Or for kids who are not seeing their parents, both of their parents are working, can a behavioral therapy robot teach them that this is the right thing to do, this is the wrong thing to do? So this itself, like a small robot which can give you behavioral therapy lessons, can be immensely useful. They have already started creating these in China and like southern part of Asia, South Korea and other places, right? So this hopefully opened up your eyes into the different kinds of healthcare products. And of course, the conversation doesn't go any further unless we talk about AI and machine learning, because that's what the entire world is talking about. So, and they are immensely useful, leveraging mobile devices and embedded AI. So this is the new age of, medical products, which we are all looking at during the COVID. Everybody has worked a lot with medical data sets, be it with lung sounds or, heart sounds, all kinds of coughing sounds. And they have been able to detect that this is COVID versus this is not COVID. So there has been a lot of breakthrough during the COVID. And that's where the AI and machine learning wave actually, propagated. So right now, the interesting part with this is a lot of this AI and machine learning has been included into apps, which are also known as products, like digital products, which are able to look at your mental health, how you're doing on a day-to-day basis, your sleep cycles, how you can improvise your eating habits and whatnot. And then there are specific applications like detection of skin cancers or tumors, right, where you can take a quick picture and you don't have to visit the doctor or worry about a doctor coming like 5 days after when you're concerned about some kind of a growth or something abnormal on your skin or on your body. So similar to what we are doing with chat GPTs and other things, just think about something very reliable where you can take a picture of the skin and it actually compares this picture with hundreds and thousands of similar pictures and tells you, hey, you know what, this is not cancerous, but please do see the doctor if it looks something, like out of ordinary. So that could help you so much into digital dermatology. And there are so many other applications where camera-based analysis, there is camera-based obesity analysis, which is in the place where you can take a quick selfie and it will tell you, this is your BMI. So that way you don't need to visit a doctor or keep a check, like yourself, sensitize that, my BMI is not going in the right direction. Let me just start, exercising more. And there are whole patient trackers, multimodal approaches. So there are lots of technologies and healthcare devices which are in this framework. So these are some of the technologies which are at the fair front and hopefully would have given you some state of the art into the healthcare products. And there are lots of innovative products which we as researchers also make. So I thought like I should also include something which I or my lab works in IIT Delhi. And these are some of the products which has come out of it. The first one is known as a slip testing device. So what this does is we have created this based on thorough design. As you can see, the second component is the design. So we have modeled this in CAD software and finally created a prototype and final product. So what this device does is it replicates the biomechanics of a slip. So what is a slip? You're walking, all of a sudden there is water on the floor, or there is some soap solution on the floor, or there is something slippery on the stairs and you slip. Most of us have slipped and fallen at some point, right? So what this device does is you take this device, this is a portable device, to a place, you fit your shoe within this place, and the ground is exactly, you have some possibility of slipping. It tests this shoe in that realistic ground and gives you the coefficient of friction by replicating the biomechanics of a slip. So that way, what can I do? Now I can go in hospitals, bathrooms, and be it a kitchen in a hotel or anywhere in an industry shop floor, I can go there. They are using certain shoes. I can test those shoes. Are these shoes okay for you to have enough slip resistance or for you to not fall down in that kind of an environment, right? So this would reduce some slips and falls. So this is a device which we have created, and this is one of a kind, like niche product which you would usually not imagine like building, so this is just to give you a flavor of research. And we have done 1,000+ tests across different kinds of bathrooms. Recently we have got some grants, like from top funding agency, which helps us, like test this further in the bathrooms to make sure that the bathroom floorings which we have currently, where the slipping chances are quite high, can we have some slippers or some specific type of footwear which ensures that we do not slip there, or can we have some flooring recommendations, right? So this is one type of innovative product. Another type of innovative product on the right side is, this is known as a upper limb orthosis for patients with ADL, or activities of daily living. Many patients are there who have had spinal cord injuries, and due to that, somehow they have lost the functioning of their upper limb, and they are not able to do their activities of daily living, like brushing or eating or combing their hair. So just using 3D design and 3D printing, we have been able to create such a rehabilitative device. So this is all created in our lab from scratch, and we have been able to clinically test it across a bunch of patients, and finally we were able to use it completely mechanical, and we can make it electronic. That is the phase 2 of it, which we are working on. So you can use one of your hands, which is okay, to switch the gears, kind of turn the gears, so that everything is lifted and you are able to take the hands close to your mouth and do the daily operations. So these are extremely important. Not commonly seen, but like ADL is a very common issue. Like if you look up activities of daily living, rehabilitation of that, like you'll find there are hundreds and thousands of people who are suffering from this, who have met with an accident, or some have fallen down, like elderly people, they are seeing that. Another product which is of use, which we have very proudly created in our lab, is a smart insole, extremely low cost, for detection of possible diabetic ulceration. So I've told you that diabetic foot conditions, or if you have diabetes, type 2 diabetes typically, you have a high chance of developing an ulcer on your foot, which will propagate and not heal by itself, and it will lead to a gangrene and requirement of a foot amputation. So in order to prevent all that, there is a thing called smart insole. Of course, smart insole is nothing new. You can buy it off a lot of companies around the world. But what is new is, it is extremely high cost. It is extremely high cost if you try to source a smart insole from companies like Moticon and TechScan and whatnot. Like it is going to cost you more than 1 lakh per pair. So there we have been able to build sensors in our lab and create a smart insole which is as low as 2,000 rupees a piece. Now think of the entrepreneurial venture out of it. Now I can basically make this for 2,000, sell this for maybe 1,000, 10,000, 1,500, and have a huge profit margin. This is all 3D printed and bunch of electronics which we have filed for a patent. So this is to just give you an example of 3 areas: biomechanics, diagnostics, and rehabilitation. So these are the 3 areas in which we have been able to innovate products. And this comes out of your research, right? Hopefully this clarifies and gives you some insights. Okay, so in the interest of time, I'll quickly take you through an entrepreneurial journey of a healthcare product, and that will hopefully open your eyes into why not every fantastic product which you think you have created out of your research is not great for market translation. So let's take a look. So this is back in the day, like this is, we are zooming back to 2015. So 2015, we started with a new technology which is known as SynSkin. So what I said here is, we have the secret recipe to fabricate customized human skin. So I found a material, type. I could create a material composition which replicates the human skin. Okay, so I was working in my lab late in the night while being a PhD student, first year PhD student, around 3 a.m. in the morning, and there was a eureka. I was trying to come up with some materials, polymer-based materials to find out what can match human skin, and all of a sudden I found a recipe. And I repeated it a few times, and I found that that recipe does mechanically simulate the human skin. So I was in full eureka moment. I was like, right now I'm going to file for a patent. This is going to change the world. I'm going to probably use this human skin for all these applications, be it for prosthetic or orthotic liners, for creating insoles for the movie makeup industry in Hollywood, for using medical mannequins or medical simulators, or building test beds for ballistic testing, that whether armors are suitable for like preventing the ballistics. So I was in full like this kind of eureka moment, that this is something which is going to change the world. I've created something fantastic out of my research, right? So we started looking into the market. Somebody asked us, so I signed up for something which is known as NSF iCorps. It is a program similar to Shark Tank, where basically what you do is you will have to pitch to the customers that, or in Shark Tank, you pitch to funding agencies, but here we have to pitch to the customers for many weeks that, this is the product which we have. What do you think about this product? What are your feedbacks? And we started collecting the feedbacks. So NSF is the main funding body in the US, by the way. So they asked us to do this exercise, right? So this is the US patent, by the way. So this was real research, not something which we just, woke up with. So this is Chanda et al. This is my US patent on biofidelic skin simulant, right? So what we did was we did the 6 weeks of something which is known as a customer discovery, which is nothing but running surveys and having a list of questions to really understand something which is really important in the world of entrepreneurship, which is value proposition. That what value you are providing to the customers through your product. And most of the values are non-technical. Are you providing a value of convenience? So what has Blinkit done to all of you? It has created convenience. It's the same, things which we buy from our day-to-day Kirana store or the market, but now we are using Blinkit because it has created convenience. So that is known as a value proposition. What has Zomato done? It's a convenience. What has other apps done? Like many of them are convenience, many of them are cost reducers. So value propositions are typically divided into something which is known as gain creators and pain killers. So what we need to understand in the market is what is the common pain of the customers in a particular target segment, not all the customers. So there is a target market that this is what I'm trying to target. These are my customers who has a problem of so and so. What are the common pains which they have? And what are the common gains which I can provide? What is a gain creator? Example is an iPhone. It's a gain creator. It gives you a brand image. You feel like you want to show your, like this particular orange color phone to everybody, and everybody knows it's this iPhone, whatever version it is, right? Like latest version. So gain creators are these, and painkillers are which are issues. So we went through this week one where we thought prosthetics and orthotics market would be the huge value for our synthetic skin product. We started from there. I will just take a few more minutes, like 5 more minutes, and I'll wrap up. So we thought there is a market for all this, and we kept on digging. And what we did find out was nobody was there to take our product. 90% of them trashed our product, saying, you know what, you have created some nice synthetic skin, that is all great, but this is not going to be useful for the actual products. And by the week 4, I was extremely disheartened. But during this exercise, what we did find out was many of them said a few things which I initially did not notice. What they said was, can you build some new products out of it? Do not look at existing products or changing the product line. Can you build some new products? And some of them commented, can you build something in the area of, footwear, or typically for reducing foot pain? And if you can create something for diabetes. And here comes, after week 6, we have completely shifted from Syn Skin to a new product, which is known as One Soles, right? So there was a great journey. It is a little longer story, but like what we did was we pivoted and we really learned from the customers that what is going to add value to their lives and what can we build out of this material which we have created. So it is not a synthetic skin, but it is an insole which has synthetic skin-like properties, where we are able to tune the properties of this material to perform a superior task of reducing pressures inside the foot. So this is this beautiful insole which came out as the product. So this is the actual product, One Soles, which came out of my company. This is US patent protected, like this is maximum grip. It is extremely washable. Like there's a YouTube video also. I don't have the time, but you could always watch it. Like I'll leave the slides with the organizers. There's a customizable arch and highly durable base. So this entire product we pitch now in Shark Tank kind of setup, and we did get some funding. Like, so now we were able to create, using the skin material, a completely different product. So sometimes you may be starting off in research with something, but it may end up in a product which is of huge value to the customers. So this is what I wanted to showcase while I do this. So that's all. I wanted to just showcase a few references. Like, so these are some books written from my group, where Healthcare Entrepreneurship and Management is a book which you are welcome to read. This is authored by me, and we have also written quite a few books on soft tissue simulants and recent advances in food processes and orthosis. So my vision in the healthcare product development and entrepreneurship is, can we combine healthcare problems, product development, and commercialization, all this knowledge through lots of training courses to build the technologies for the nation, like which are into the area of diagnostic, monitoring, treatment, rehabilitation, well-being, and have inventions and startups. And I would like to take the opportunity, just 30 seconds, to go through some of the training courses which we offer. There is an online PG diploma program in healthcare product development and management. It's a 12 months program. Batch 2 is running right now with enrollments open. And executive program in healthcare entrepreneurship and management. This is batch 4, enrollments are open. So basically, this have affiliate status and everything from IIT Delhi. This is done in collaboration with AIMS, and you get a degree kind of thing in the convocation. So this is just a quick snapshot of all that. And there is a video which I had, but in the interest of time, in the healthcare product development and management, I'll skip that and leave it with the organizers. So just 1 second. So that's it. Like, thank you very much. These are some collaborators I would like to acknowledge who have been extremely instrumental for us in building a lot of healthcare products. So I'm hoping through this presentation, this would have motivated some of you to understand what are the healthcare challenges in India, what are healthcare products, what can we build, and if we are trying to become entrepreneurial, what all things to keep in mind. Of course, time is short, but hopefully this would have given you some idea into healthcare product development and entrepreneurship. So thank you very much. Thanks for listening. Yeah.
Thank you, sir, for delivering such an insightful and valuable session on healthcare products development and entrepreneurship. We now invite questions and discussion from the participant if there are any. I request all the participants to type their question in the chat box.
Okay, so I'll take a look at the chat box if there are any questions. So the first question is from Bharat. What type of ethics or regulatory approvals we have to take care while developing the products? So it depends. Actually, the class of product which your product falls in. So if you're in building a wearable technology, which is just touching the periphery of your body, it is good news that you do not need a lot of regulatory approval. These are known as self-notified devices. So they would usually come under the class 1. You still need to approach the CDSCO. That's the main governing body which gives you the approval to sell those devices. But it is a self-notified device, so you can quickly go on with this. If you have some invasive component associated with it, it usually falls in class 2. So there is a clear guideline into what all tests need to be conducted. So there has to be some clinical trials and other steps which needs to be conducted, right? If you go for higher classes, which are high-risk devices, includes implants, systems which goes inside the body, then you need to do a thorough set of tests, which involves tests like cytotoxicity, genotoxicity, which are all considered tests of biocompatibility, which means whether once you place this device inside the body, will it create any adverse reactions or not? So these are all stated under the regulatory framework under CDSCO. So it all depends on your class of device. But if you're trying to be very entrepreneurial, my recommendation is go for wearable technologies where regulations are minimal, right? So this is the first answer. Yeah, you're most welcome. Next person, you're welcome. Yeah, everybody is welcome. I think, Bharat, if we undergo the robotic surgery and meet with some adverse condition, what a patient can do in such cases as a patient, or what are the rights of the patient? Yeah, this is a good question. Not exactly about the product, but basically what you're asking is, what if a robot fails, right? So that's the kind of question which I see. So of course, a robot can fail, and that's why a robot is not usually performing the surgery completely by its own. It's a guided robotics. So there is usually a person or a trained doctor who is looking behind this robotics. So robots are not trained to do this personalized level kind of surgeries. But yes, there are lots of regulations which are coming into the picture. This is a landscape which is evolving, and you will have insurances which covers robotic surgeries and things like that. They are getting covered more and more, which will also cover damages for robotic surgeries eventually. So those are the things which will come in places. They are already there in the foreign lands. But in the Indian context, robotic surgeries are minimally, looked upon. Like very few people are considering it so far. So those laws and ethics have to be improvised there in an evolutionary framework right now. So there are very limited rights. If you look at that, you can just go to the consumer court and probably fight cases for now, right? So yeah, Dr. Yatinder, you're most welcome. Others are welcome. How do you facilitate effective communication between engineering team? Yeah, this is a great question. And the healthcare professionals involved in your project. So, what we do is we are engineers. Then you talk to a clinician. So we need to have three kinds of people in your team to be entrepreneurial. You need a clinician or a doctor. You need engineer who can build things and, change an idea to a design. And then you need a management professional who can actually do the marketing, sales, and bring it to the market, right? So these three things have to come together. So how do we effectively communicate? We have to be on the same page. Like what we need to do is everybody needs to do their task on their own, and we need to see this as a puzzle which is coming together. So you should not be talking like technical terms with a clinician, because they will not understand that language. And similarly, if they tell me that these are like so and so anatomical portions where things are happening, I may not understand as an engineer. So what they need to tell me is, this is what my idea is, this is what my potential design is, and you try to come in a consensus as an engineer into that design by understanding in your own words how the design should look like, and then you take it forward. So that is how we do it with AIMS doctors or clinicians whom we talk to, because they don't understand the design and prototyping. They understand the problem, they understand the anatomy, they will tell you where the problem is. You need to change it into a solution as an engineer, right? Into a designable solution and prototypable solution. And then the marketing professional does the third phase of the running. So that's typically how we communicate, between that. So all the communications have to be crystal clear, that it's a chain kind of mechanism. They cannot go in parallel, right? Hopefully that answers your question. So you talked about one system product in case of spinal cord injury. Any product which help in restoring the balance of body in case of ataxia, in some cases with different walkers when not functional. So this particular question I don't have an answer to. I'll have to look it up because that's not my area of research. But I think it's a good question. I can always look it up and get back, Akansha. Yeah. Thank you. Will you give me information about laws and regulations in India regarding? Yes. This I teach, all the time. And by the way, there is if you are looking for information about these areas, I also have an NPTEL on healthcare entrepreneurship, which is starting on the 17th of this month. So you're welcome to, look at it. There we will be talking about a lot of Indian regulatory compliance. And if you need some slides, I can always provide those. So those things are there, right? So most welcome. Yeah. Any other questions from anybody? Okay, if not, like to thank you all. And I'm really hoping that this has been informative. Of course, the time was short, but I tried my best, I think, to consolidate all that information, and hopefully this will spark some interest and motivation in you to build the healthcare products. That's the goal. Thank you.
Thank you so much, sir, for giving us such a enlightening talk, and especially your journey, that since skin to souls. That was very inspiring and motivating for us. Thank you so much, sir.
Thank you so much, Dr. Shilpa and the entire team of NSUT for hosting. Thank you. Yeah.
Thank you.
All right, so I will take leave now. Thank you.
Okay, sir. So our next session is at 8 p.m. by Dr. Caroline. She will talk on clinical applications of stem cells in advanced wound care. So we can take a short break. The meeting is on. Do you want to say something, Dubey, Professor Dubey? Sir, your audio is off.
Yeah, it's okay. Okay, I'm just complimenting the
Acha.
speaker, Dr. Arno. Yeah.
Yeah. I think he's
Okay.
left the meeting. So we'll start our next session at 8 p.m. The meeting is on. We can take a quick break and be back at 8. Thank you.
Thank you. Thank you, Twinkle. Thanks, Shilpa, for inviting me for this talk, and I'm always happy to share my experiences and the journey, and how we are developing things in the stem cell field. So let me start by sharing my screen. Okay. So today I'll be talking specifically about, how we develop stem cells for advanced wound care. So this is basically all about translational work. But during my discussion with Shilpa, she said it would be good to sort of, give a background so that everybody's on the same page. So my presentation, I've just broadly divided it into two parts. One is an introduction to stem cells. And the second one is stem cells in advanced wound care. So this may be a little basic for some of you, but for those of you who don't know about this field, it may be useful to understand the context of the later slides. So if you go by a definition, stem cell is basically an undifferentiated cell. So if you think of from where we started in life, it started from the embryo. So from there, differentiation starts after the blastula, morula stage, and then we get different tissues and organs which are functional. But a stem cell is something which retains the original potency. So it is an undifferentiated cell, but it has the potential to give rise to a different type of cell or different types of cells depending on the potency. Now, the unique thing about stem cells is what we call as asymmetric division. So if you look on the right hand side, you will see that if you have a mother cell, it can either give rise to daughter cells which are similar to the parent cell or which are differentiated. So this is called as an asymmetric division. Now there is another classification based on potency. So you have totipotent, pluripotent, and multipotent stem cells. So toti, the word comes from total. Now an example of this is an embryo which has been implanted and has all the extracellular membranes. So that is an example, and this can give rise to an entire organism. So that is an example of totipotency. This kind of stem cell research rarely happens, if at all. The second one is pluripotent. Now these are the embryonic stem cells. So if you look at my cursor, if you go from here, this is the inner cell mass. From the inner cell mass, anything without the extra embryonic membranes. Now, if you think of an embryo, it cannot develop into a multicellular organism without the extra embryonic membranes. Basically, I'm talking about the placenta, the fetal tissues, and the protective membranes which allow the fetus to grow into a complete organism. So there are but regulations. So when you talk about embryonic stem cells, it is more of a restricted area of research. I'll talk a little more about the regulatory overview in my next slide. But these cells have the maximum potency among all the stem cells that we are allowed to work on or conduct research on. So they can form into all the different lineages of the body. Now the next classification that we have are the multipotent stem cells. These have little reduced potency compared to the pluripotent or the embryonic stem cells. They are also called as adult stem cells or somatic stem cells. And then they have limited powers of differentiation. So it can be unilineage or maybe multilineage, but again, it is limited with reference to the embryonic stem cells. So this is an example of a single or unipotency that we call a single lineage differentiation. So for example, if you were to take cells from the bone marrow, so you can see you look at a hematopoietic. Hematopoietic is the blood lineage. Non-hematopoietic is the non-blood lineage. So you can see that a hematopoietic stem cell can divide into the myeloid or the lymphoid lineages. So if it's myeloid, then it will go on to form your RBCs and platelets. If it forms lymphoids, then it forms your immune system, your T cells, your B cells. But all these cells belong to the same lineage, which is the hematopoietic or the blood lineage. So this is another example that I gave. So if you look at the nervous system, you have a neural stem cell and that can differentiate into different cells, but belonging to the nervous system. So coming back to this, when a little more in detail about embryonic stem cells, like I said, it has restricted research. Most regulatory bodies in like 50 odd countries which are carrying out stem cell research as of today, they say that first of all, the embryo should not be implanted. So when I'm talking about stem cells, it's all to do with human research. It's nothing to do with animal research. Human stem cells is my area of expertise. That is the adult stem cells. So when we talk about embryonic stem cells, there is a restriction to the number of days after division. So if you remember your school or college biology, you would remember that a sperm and an egg, they unite to form a zygote. And then after the cell division, it is restricted to 14 days. Beyond 14 days, you cannot culture the embryonic stem cells. So this is part of regulation. So you use the inner cell mass. Now, you must remember why there are restrictions for embryonic stem cell research. So one of the what we would call a very important marker of embryonic stem cells is because of very, very high rate of proliferation or cell division. So if you remember how life started, at the very, very zygotic stage, blastula, morula, and so on and so forth, the cells have to divide rapidly because it's the beginning of life, beginning of an organism. So cell division has to be rapid in order to make that organism. As it reaches different differentiation levels in different tissues and organs, then the potential of cell division reduces. But because of this problem of very high cell division, there is a problem of forming a teratoma. Now, what is a teratoma? It's like a benign tumor. If you take a cross section of it, you will get all the three germ layers. So you'll get the ectoderm, endoderm, mesoderm. Okay. You'll get nails and hair as well. So what people do in order to test whether this is an embryonic stem cell or not, you can inject it into a skid mice or not mice and nude mice, and these benign tumors will form. So when you're talking about therapies using embryonic stem cells, this is one of the limitations, that it forms teratoma. The second thing is, I just want to briefly touch upon what is called as the Hayflick's limit. So for those of you who are familiar with cell culture, you would know that a normal cell will divide a certain number of times before it dies. So this is a very interesting backstory that I will share with you if you go through the history of how cell culture started. Somewhere in the 1920s, there was this scientist called Alexis Carrel, and he first started working with chick embryo fibroblast culture. So what he did was he grew chick embryo fibroblasts. Everybody was very excited, well and good. Now the problem that came in his scientific research was he kept feeding nutrients to the fibroblast culture, which was made of the chick embryo extract. And this was a long-running culture. So this culture of his, he managed to keep it for 34 years. And, you know, people were amazed. They were like, how can you have, you know, such a long-running culture? And when other scientists were trying to replicate that, they were not able to do it. So his theory was that if you have, you know, a fibroblast culture or any cells in culture, so long as you give it the proper environmental conditions and the nutrients, it will grow indefinitely. This was his theory till Hayflick came into the picture. That was in somewhere in the 1960s. So say 34 years of Alexis Carrel maintaining chick embryo culture, and nobody else in the world is able to replicate it, till Hayflick came into the picture, and he said, no, this is wrong because there is an error in the experimentation. And he showed that when cells divide, there is a shortening of the telomere. And that is what leads to cellular aging and senescence. So that means after a number of cell divisions, if it's a normal cell, it is going to die. Except Hayflick's limit does not apply to embryonic stem cells. And if you can think, what is the other kind of stem cells that it does not apply to? Cancer cells. So in both these, there is unregulated proliferation. So this is the care that you have to take when you're carrying out embryonic stem cell research. Now coming to adult stem cells, these are also called as somatic stem cells. So here also they are there in almost every tissue and organ of the body, but they are by definition undifferentiated cells which are there in differentiated tissue. So say for example, you have liver or you have kidney or any organ of the body, they will have stem cells. So if there is a disease or an injury, then these cells, these stem cells come into play, they get activated and they come and help regenerate or heal the body. This is how body's natural healing processes take place. So they are also there in the bone marrow, skin and gastrointestinal tract, but here they divide continuously and they are always there. So you know that, you know, skin turnover is high, or in the bone marrow it has to keep regenerating because you know, the blood cells that we have, they have a definite span. So if the bone marrow is not working, then there is a problem in the body. So in other organs, they remain dormant till they are required for repair and replacement. And one of the cell types that I'm going to be talking about today are the mesenchymal stem cells. So mesenchymal, the word comes from mesenchyme. It is like a loose connective tissue. So that's the origin of that term, mesenchymal stem cells. And then the third kind of stem cells are not, you know, there in nature. It is man-made or lab-made. They are called as induced pluripotent stem cells. And this is done by reprogramming the adult stem cells. So if you look at this example that I have given on the right-hand side, say, for example, there is a person who is suffering from, just for the purpose of example, suffering from liver failure. So you can take, you know, a skin biopsy, separate out the skin cells, maybe fibroblasts. You can do genetic reprogramming to de-differentiate these fibroblasts into the embryonic stage. So when I'm talking about differentiation, this is the opposite. It's going in the opposite direction. So de-differentiation, where it goes back to the embryonic stage, and then you re-differentiate it into the liver cells, which can be used for transplant. So if this person has a liver problem, you can probably use it theoretically. So the advantage of this is you are using cells from the same patient. So the donor and the recipient are the same. This is called as autologous stem cells. And then you have allogenic, where the donor and the recipient are different. So when you look at, of course, I mean, there are considerations again when you talk about autologous, allogenic. I'll come to it in a bit. So when you talk about regulatory considerations, there are few key points that you need to keep in mind. One is, what is the level of manipulation? So say, for example, you're taking a bone marrow, extract from somebody. Are you just centrifuging it? Are you culturing it long term? Are you doing any genetic manipulation? Because of long term culture, what are the changes which are reflected in the culture? So based on that, there is regulatory oversight. What is the use? Is it homologous or non-homologous? So for example, homologous means, so say skin has the function of being a barrier for the body. If you're using it for the same purpose, it becomes homologous. But say you're using a bone marrow extract and injecting it in the knee for knee regeneration, cartilage regeneration, that becomes a non-homologous use. So the function is different from what nature intended it for. And then you have autologous and allogenic. So I've already told you what autologous and allogenic are. But again, when people do research on these two types, again, the considerations are, can you scale up? Or what is the immune rejection or reaction in allogenic? So here, when I give you this example of iPSCs, again, another example is, you would have heard of CAR T cells. So CAR T cells is a form of autologous immune therapy for cancers, where they remove the T lymphocytes, they genetically engineer it so that it attacks the cancer cells when it's re-injected back into the body. So now there are CAR NK cells also, natural killer cells also. So the difference is, in autologous, you can do limited scale up. So for each patient, when you manufacture, it is intended only for that patient. So there is a limitation of large scale scaling up. Allogenic cells, you can scale up and it becomes like a mass produced drug, biological drug, for patients having that indication for which you're developing it. So now again, what are the sources of stem cells? So you can have it as cord blood, umbilical cord tissue. These are, so even when I say cord blood or umbilical cord tissue, it is a newborn baby, but once it is delivered out of the body, it becomes an adult stem cell. So it's not adult like how we think what adult is. It is, anything which is out of the body. What is within the body is called as fetal stem cells, which I'm not going to talk about today. I'm talking only about adult stem cells. So you can also get it from the bone marrow, peripheral blood, menstrual blood, and so on and so forth. And the place where these stem cells are found are called niches. So, it could be if you look at this slide, you can see that stem cells are there in their homes, which are called niches, in every organ or tissue that you can think of. And it is designed like that. Nature has designed it so beautifully so that anywhere in the body, if there is an injury or a disease, then the body can help to regenerate or reheal itself. So when, keeping that last slide in mind, when you look at the potential uses of stem cells, so right from the head to the foot, you can develop any application. And they are mostly present in low numbers in most tissues. So how stem cell therapy started was, people thought that, okay, maybe hepatic stem cells are present in lower numbers. Why don't we grow them outside in the lab and help to boost the body's natural healing processes? Basically, that is how this whole premise of stem cell therapy came about. So you have to enrich it, you have to expand it before use, because it's there in the body in smaller quantities. The second thing you have to remember is, if you think of a small child who has fallen down and hurt himself versus maybe a 60-year-old man who has fallen down and hurt himself, the smaller child is going to recover faster. His skin will heal faster compared to a delayed healing in the older man. So why is this so? This is because as we age, the stem cell population in our bodies gets slowly reduced. It gets depleted. So according to me, the best source of stem cells that we can have is from a newborn baby, which is why we started working with umbilical cord. So a little bit about my background. Org Therapies and Research Private Limited is a biotech company that I founded. It's about 14 years old now. And we develop ethical and sustainable stem cell applications. So for both clinical and cosmetic use, it's a very interesting story, but sometime in the future, I would be happy to share with you how we reached here. But today I'm restricting my talk to advanced wound care. So our core technology is a xeno-free technology, which means that from A to Z, we do not use any animal-based products anywhere in our processes. So whether it be trypsin or FBS or anything, we have eliminated all these. So we have a xeno-free technology, because of which it's very biocompatible. And also from the point of safety and regulatory standpoints, this becomes a very, very desirable kind of cell and gene therapy product. So like you can see, that is one of our first points that I've noted there. It's a xeno-free stem cell secretome. So we started off with a cell-based approach, but we, by evolution and as part of our research, which I will share with you today, we also came upon the fact that stem cell conditioned media, which is the secretome, can also be like a cell-free therapy for various indications. So it's not cell-based. There are many advantages of going cell-free. And then it is non-invasive. So since we use umbilical cords, you're not poking somebody to get adipose tissue, or you're not poking somebody to get a bone marrow extract. This is like a biological waste. So, we make gold out of waste. Then, like I said, it's the youngest source. It's very potent, very naive. And what we have found in our research is that it is the best quality that you can get. From a newborn, maybe you cannot get any better source than this. So we have patents granted in a few countries and pending in a few countries. So this is what we do. We want to do it ethically, and it's a very sustainable way of operations, because we are not going to run out of umbilical cords, right? So we go through a very ethical sourcing. We have our own ethics committee, which is registered with the regulatory bodies. Then whichever hospitals we collaborate with, they have their ethics committee. It goes through that. There's a very detailed, documented, informed consent process, which includes audiovisual consent. So there is a long drawn process. And then in order to ensure that the cords are in the best quality that we can use, we carry out infectious disease testing and ensure that the best quality is your starting point. So right from the starting point, we ensure that we are in the best possible state. So when it comes to wound healing, this is what we wanted to identify. What is the gap? So when you talk about wound healing, say, for example, you take a skin graft, and that is the gold standard for wound healing. So extensive burns or ulcers, what doctors or surgeons do is they will take a piece of skin graft from another undamaged part of the body and put it onto the damaged part. So this creates a secondary wound site. It increases the trauma to the patient. So we developed, we started, this was our starting point. We said, how can we do this? So we attended a lot of surgeries. There were burn surgeons who were kind enough to invite us into their OTs. We could see this entire process of how skin is grafted, how it is harvested, how it is meshed, and how it is grafted. So we got an understanding of what the gap actually is. So like I said, I have already spoken about this. I'll skip to the next one. So a little more about mesenchymal stem cells. So they are multipotent adult stem cells. So when you remember, when I talked about the classification, I talked about totipotent, pluripotent, and multipotent. So multipotent cells, why it's easier to work with these adult stem cells is the growth is not unregulated. Like they follow the Hayflick's limit beautifully. So there is no chance that if you inject mesenchymal stem cells into nude mice, it's going to form out tumors. No, there have been hundreds of studies worldwide where people have studied these kind of cells, irrespective of the source. So it could be from bone marrow, umbilical cord, or any other source. But nobody has ever reported that there is, any tumor formation or any such problem. And then you can get it from any tissue. Like in our case, we get it from the umbilical cord. So how do you, characterize these cells? So because my next slide onwards is going to be a little technical. So I'll just give you a little background about this. There is this International Society for Cell and Gene Therapy, ISCT. So they have published a position statement. In 2006, it was authored by Dominici et al. It is the minimal criteria for defining these multipotent mesenchymal stromal cells. And there are three criteria which are very, very critical. So first one is the cells should be plastic adherent. So these are adherent cells, not suspension cells, when maintained in standard culture conditions. They should have positive markers CD105, 90, 73, and lack of the other negative markers. Now, if you see the negative markers, it's CD45, 34. These are the hematopoietic markers, right? These are the blood markers. So from that itself, you will know that the mesenchymal stem cells that we're talking about are non-hematopoietic. That means they do not form part of the blood lineage. Very importantly, another negative marker is HLA-DR. Now, if you remember your HLA typing for organs, mostly for organ transplants or for bone marrow transplants, you need to have an HLA matching of 6 out of 6 until and unless it's a cord blood unit which is being used instead of a bone marrow transplant, then you need a 4 out of 6 match. Now here these cells lack HLA-DR, which means this is very amenable to allogenic cell therapy. So that was what I told you earlier about autologous and allogenic. So this means that I can mass produce a cell-based drug and use it. So I don't have any restrictions in scaling up and manufacturing. And the third one is the trilineage differentiation. So it can differentiate into osteoblasts, adipocytes, and chondroblasts. That is nothing but the bone cells, the fat cells, and the cartilage cells in vitro. So with that background, this is what we did. First, we collected a lot of cords, and we said, let's look at the long-term stability of these cells. So after we harvest the cords, we did all these characterization experiments. So we did flow cytometry studies for, cell viability, and then also the positive and negative markers. We looked at, so what we did was, okay, let me explain this slide a little more in detail. So what we did was, we collected like 10 to 12 umbilical cords, which were good. And then we started growing the cells. These are, of course, after ethics approval, informed consent, infectious disease testing, and all those things. That's the prep work that we need to do first. So then what we did was, the freshly isolated stem cells were characterized by flow cytometry, and then all these other experiments. So CFU is a colony forming unit assay, which looks at the stemness. What is the stemness of the cell population? Population doubling time, of course, it's very important. You need to know, because how many cell population doublings? So one thing is, you look at passage number, P1, P2, and so forth. Or another more scientific approach to study cell senescence and aging is to look at the population doubling time. So what we did was, we divided it into master cell bank up to P2, P3, and working cell bank up to P6. So early passage and late passage. And then we characterized for all these parameters and put it into liquid nitrogen. And then at every 6-month interval, we thawed it and again repeated all these parameters to see whether there is any change after prolonged cryopreservation. So when we did that, we did it, remember, across early passage, late passage, and different time points. So for this study, which was, we got funding from BIRAC. I don't know if you've heard of BIRAC, that is Biotech Industry Research Assistance Council. So we got a big grant, BIG, that is Biotechnology Ignition Grant. It's not very big, it's small, but okay, that's just a joke. So we carried out these studies, and for this, we did it over a period of 28 months to see whether there is any difference between the freshly isolated cells and the cryopreserved cells. So what we found was there isn't. So when you look at, you know, your ANOVA and your P value of significance, it should be greater than 0.05. So this is a representative image for flow cytometry studies, again for positive markers, negative markers, early passage, late passage, P2, P6, so 0 months, 6 months, 12, 18, and 28. So as per this definition, ISCT definition, positive markers should be more than 95% and negative markers should be less than 2%. So for us, I mean, cell viability remained unchanged. It was in the mid-90s, which is a very good viability count, which confirms that our xenophy processes were working really well. And then we could do a trilineage differentiation. So the first one is bone, that is osteogenic lineage. Then this is the cartilage. So this is the control and this is the test. And then C is adipogenic. So you can actually see these oil globules which are stained red. So we carried out those studies. And then soft agar assay is an in vitro method of testing for tumorigenicity studies. So remember I talked about teratoma formation or benign tumor formation for embryonic stem cells. So, I mean, we know that mesenchymal stem cells will not form tumors, but instead of doing animal studies, you can do it in vitro just to confirm that nothing has gone wrong. So here what you do is in the soft agar assay, it's like a sandwich. So you grow it on a layer of soft agar and you find out if the cells are able to grow or not. Remember, I told you that these cells are supposed to be plastic adherent. So if you do not give the cells any substrate to attach or to adhere to, then they do not proliferate. So if you look here, on the left hand side, day 0, 8 and 21, the cells are not able to grow. Whereas the positive control, we have used breast cancer cell line, that is MCF7, and that grew because you know, they're cancer cells, they are anchorage independent, they don't need any substrate to grow on. And then to double check again, we have done karyotype analysis to ensure that after prolonged culture and expansion and cryopreservation and thawing, the karyotype is not being messed around with. So the karyotype is normal diploid karyotype. So that also we found out that it's perfectly fine. And this is the publication that you know, we published of the BIRAC funded project. Then we said, why not we look at, you know, the stem cell conditioned media to see, you know, if we would be able to come up with, you know, a better way of carrying out therapy. So not just a cell-based, but a cell-free. So we started collecting. In the initial days, we used to throw this away. We used to discard autoclave it. But then we started saying that let's analyze this and see what's there in the conditioned media. And to our surprise, we found that it has a whole range of beneficial, you know, cytokines, chemokines, growth factors, which can help in regeneration of tissues. So when you talk about stem cell therapy, again, there are two schools of thought. There are people who say that the cells themselves contribute to the healing, But nowadays, more and more people are beginning to realize that it's not the cells, but the paracrine interactions which are helping towards tissue regeneration. What are the paracrine interactions? That is nothing but the cytokines, chemokines, and also we said, I mean, of course, we were a little ahead of the game. The time that we started this about 10 years ago, that we were already thinking of this. But now everybody is talking about exosomes and secretome and so on and so forth. So we were a little ahead of the game at that point. So we said, let's go and analyze this, the stem cell secretome. So the first things that we do is we carry out biocompatibility or cytotoxicity studies. So we did that on 3T3 cell line. Viability looked fine. We looked at protein content across different patches, antioxidant activity. Then what are the growth factors? We did the profiling of the growth factors. And then we were like, oh, not bad. We have all the paracrine interactions, which may be responsible for, tissue healing and regeneration. Then we also did, of course, FTIR analysis just to check batch to batch consistency. And then we finally did a proof of concept study. This was in collaboration with Hafkin Institute in Mumbai. So they carry out fantastic animal studies. They are mostly known for their work on snake venom and toxins, but they collaborated with us for this study. And there was another interesting institute called IMEC from Belgium, which later on became an Indian company called Spectral Insights. So what they did was hyperspectral imaging for us. I'll tell you a little bit more about that in my next slides. So this was an excision model of wound healing in rats. The treatment groups were low, mid, and high dose. So the low dose was 500,000 cells. Mid dose was 1 million cells, high dose was 2 million. And of course, the MSCCM, which is like no cells at all. And this dosage was given just once, at the beginning of the study. As soon as the wound was formed, there was no repeated dose, but we were surprised to get the kind of results that we do. Other parameters that we looked at was rate of wound healing, the serum cytokine, serum of the rat, the collagen content, histopathology, and hyperspectral imaging. So here, apologize for the quality of this slide, but here, if you can see, for body weight, there was not much difference. But with respect to the area of wound healing, there was a huge difference. You can see the p-value there. So, and there was a difference with time points. So I'm talking about early wound healing, which was confirmed by later studies by us, and also with respect to the different groups. So here we found that, this was quite important. All the treatment groups had comparable results. So whether it was the cell-based or the cell-free groups. Then when you looked at the serum cytokine analysis, we said that, inflammation levels are lower in the treatment groups. Hydroxyproline assay, it estimates the collagen content. Many people are under the impression that if you have a higher, collagen content, it's good. Not necessarily, because there is also something called a scar tissue or hypertrophy of the wound. So there also you will get a large amount of collagen, which is not necessarily a good thing. So what we were looking for was scarless wound healing, which will give, at the end of wound healing, we want the skin to look as normal as possible without any scar tissue, especially when you consider burns, So apart from regenerating the skin tissue, what is important is the post-trauma. After the skin heals, there's so much of scarring, there's so much of dead tissue. And sometimes it interferes with the functionality. So suppose the hand is burned, and then to release the scar tissue and get the flexibility between the fingers, it's like a long journey involving many operations. So the idea was to get or achieve skin regeneration or tissue regeneration without the scar tissue. So This is these are the slides of the hyperspectral imaging that I was talking about. So this was very interesting, which we said, instead of doing it the normal way, like, well, okay, we've done all the other parameters, we've done hydroxyproline, we've done serum cytokine analysis, we've done histopathology, but what more can we do? So this is where Spectral Insights helped us. What they do is, like, say you have this slide, they actually developed an algorithm for quantifying the different parameters. So this is how it was done. So you take a biopsy on a glass slide, and then it scans it. It takes at least 2,000 images, stitches it together, and then it can quantify it like this. So say, for example, these are the parameters I looked at using the hyperspectral imaging quantification. So HSI quantification. So if I look at, for example, epidermal cover or epidermal thickness, so I actually got values for each of these parameters. And I would say 80% of these parameters were in agreement with the other data that we found. So by doing the normal histopathology. So this was quite an interesting finding that we had. So this was the proof of concept study. It was very important for us because there were, a lot of important findings for us. The first thing was we used human biomaterial in a rat model. So it's across species, but we did not find any immune rejection or reaction issues at all. Absolutely safe. You could see from the body weight that all the animals put on weight. They were not under distress. No animal died. We did not lose any animals. So, they were all very comfortable and, in fact, thriving. So safety was, established. The second important finding was that whether we use cell-based or cell-free, it was good enough. It was comparable enough. So if you look at this pic, if you look at untreated control by the end of 3 weeks, if you look at the MSC CM, it's MSC, it is almost healed, and in the CM1, it is completely healed. So, I mean, this set us thinking that this was a very pivotal study for us, and that's a publication. It was a big group of us which contributed for this study. So that was what we realized, that it need not be a cell-based approach, and a cell-free is probably safer, more doable. So for example, if we were still today trying to do a cell-based approach, then we would have to figure out the logistics. So how are you going to send the cells to the doctor who's going to use it? How are you going to train the doctor to thaw it and administer it without any contamination issues? What are the doses? So there are so many questions which would remain unanswered. It has to be transported and stored in liquid nitrogen. For conditioned media, we don't need minus 196. You can store it at minus 20, but we went one step ahead. We also made a topical formulation so that the end user can use it himself or herself. So you don't need a doctor to inject it or administer it. It's part of our patented processes. So that's what we've done. We've taken a cutting edge science, and we've developed an application for wound healing, which is very, very user friendly. So what we did was we have harnessed the cytokines and the chemokines and developed it as a topical formulation so that it can be used towards tissue regeneration and wound healing. So we've completed preclinical trials now, and we in 2026, this year, we are starting first in human clinical trials. That's where we stand at the moment. This is the core team. My co-founder is Mathin, and Wilfred is the head of QC. These are, of course, our investors who have been with us. So the first investor that we had was actually the government of India. Department of Biotechnology, apart from the BIRAC funding, they gave us follow-up funding which was equity based. So we were very proud of the fact that the government of India invested in us, and then we got our other investors. These are our, people who help us, part of our research advisory board. So we have people from all over the world, and this is our trajectory. So this is where we are at the moment. We are translating whatever findings we had in the lab to clinical trials. So these are our collaborators. Of course, we have ACTRIC, and these are some of our achievements. So, and of course, these are our patents and publications. I want to leave you with just 2 publications. So this is a paper that I authored with a friend of mine, Neeta Kang. She was at that time in Vellore Hospital. So we together wrote a paper about how we can achieve stem cell therapy in India. So keeping the Indian regulations in mind, it's quite an informative paper. If you want to, it's freely available. You can read it. Another useful resource is the National Stem Cell Guidelines 2017. So it explains everything beautifully, how you can do, whether it is basic research or applied research, how you can go about it. And section 13 is what I have contributed to the National Stem Cell Guidelines, that talks about the stem cell secretome, that is the cell-free approach to therapy. So with that, I come to the end of my talk. Thank you so much.
Thank you, ma'am, for the highly informative and enriching session on a clinical application of stem cells in advanced wound healing, and for sharing valuable insights from research. Now I request the participant to post their question in the chat box so ma'am can answer them.
So the first question, is that for me from Bharat, or is that for the previous talk? I don't know.
Ma'am, it was for previous session.
Previous talk. Okay.
Yeah.
So I don't think there is any question for me. That's great, actually, because I think either everybody has understood everything or nobody has understood anything. So,
No, ma'am, it was really
I hope it's the former.
You had structured the talk very nicely, starting from the introduction to explaining the concepts and then slowly going to the advanced thing.
Yeah, I mean, good you told me about it. So that's what, otherwise I would have directly started with what we do. So I thought it was better to, you're all most welcome. If you have any questions later on, you can, contact me through Dr. Shilpa, and I'll be happy to, share more information or any guidance or anything. I'm always happy to do that. So, yeah.
Okay, so if we have any questions, we can post here. All right, ma'am. I think they don't have any questions. Thank you so much.
Okay.
Yeah, ma'am.
You're most welcome, and thanks for having me. Thanks for having me.
And we are even delighted to have you to talk on this such an important topic. Thank you so much, ma'am.
You're most welcome.
Thank you. So we have posted links for attendance and feedback for both the sessions. You can fill that.